Good morning, everyone. It's my pleasure, my honor to be here in a room with giants and pioneers in this field. And so thank you all. Just a little bit about my background. I'm a OBGYN, and I still do obstetrics. I have a concierge OB practice. I have an aesthetic practice from head to toe, and I'm a cosmetic gynecologist. And about 8 years ago, I left academic medicine to start my private practice. And my journey took me down the path, and here I am. And so allow me to share a little bit of my experience with exosomes in women's health. So stem cell-based therapy is exponentially growing, and it's due to its powerful therapeutic potential for tissue repair and regeneration. And the stem cells are classified into embryonic and adult stem cells. We're not going to talk too much about embryonic stem cells for reasons that are pretty obvious, but for the adult stem cells that are out there, mesenchymal stem cells, or MSCs, are very preferential due to a number of reasons. They are low in tumor potential in vivo, and therefore is safer in the clinical application, and it has low levels of expression of major histocompatibility complex, or MHCs, which then leads to a lower detection by your immune system. There are other stem cells, and more we're getting into the really the science of regenerative medicines. For example, the induced pluripotent stem cells that won the Nobel Prize Award with Dr. Yamanaka. So MSC stem cells, they are everywhere. They're isolated from different adult tissues. And when we're talking about adult tissues, the postnatal tissues are also considered adult tissues. And these include the umbilical cord blood, the Wharton's jelly, our placenta, and the amniotic fluid. But the areas that we're more familiar with is our adipose tissue, our bone marrow, and other tissues such as urine and dental gingiva, endometrium. In vitro, we know that MSCs differentiate into different types of cells. For example, your fat cells, your bone cells, neuron-like cells, muscle cells, and other connective tissue. So why are they so powerful? It's because, first of all, they are stem cells. So they self-renew, and they have the potential to differentiate. But the MSCs are specific because they have properties that are anti-inflammatory. They promote angiogenesis and neovascularization. They inhibit fibrosis. They're neuroprotective, and they can modulate our immune system to become more immunosuppressive. They promote the Th1 and the the Th2 and the M2 macrophage response. So what we know about MSCs and stem cells traditionally is their ability to home in, migrate, engraft, and differentiate into different types of tissues at the site of injury. And the thought behind this is that it replaces aging cells and your dying cells. So in this graph, or in this photo, you can see that in vitro, we have seen that these cells can, first of all, self-renew, and then also it can differentiate it into multiple tissues. However, more recent studies are showing that it's their paracrine activity that may be the key, if not more important. So in fact, the MSC-sourced conditioned media outperformed the MSCs itself in bone regeneration. And the stem cell-sourced conditioned media is sufficient by itself to promote structural regeneration and recovery of bone defects and ischemic high limb injury in animal models. And the subsequent data suggests that these extracellular vesicles may be at least responsible for their paracrine activities. And specifically, exosomes are the main paracrine effectors of the MSCs. Through their cell-to-cell communications, they transfer their bioactive lipids, proteins, nucleic acids to their recipient cells. So in this photo, you can see that MSCs secrete secretomes as well as extracellular vesicles to affect anti-inflammation, modulate your immune cells, fight apoptosis, improve angiogenesis, and therefore regenerate your tissue. So these MSC-derived exosomes are specific in size. They're approximately 40 to 160 nanometer in size, and these EVs are secreted by the parent cells, the MSC cells. They're found everywhere in different bodily fluid, and they're made of lipid bilayer membranes that contain proteins, mRNA, microRNA, and cytosol components that really reflect the molecular and genetic profiles of their parent cells. So they play an integral role in the intercellular communication. However, because they don't express MHCs, they are not recognized by our immune system. So this picture shows that the parent MSC cell, through endocytosis, form these exosomes that are then released. And this is an exosome where the lipid bilayer has the components like I mentioned. So exactly what is its role? So the MSC exosomes really maintain the broad therapeutic effects of the parent MSC cells, and therefore the soldiers that are carrying the orders from the general, which is the parent stem cells. So they have very similar function as to their parent cells, anti-inflammatory, immunomodulating factors. They're actually bacteriostatic. And due to their ability to cross the blood-brain barrier, they also have multimodal neuroprotective effects. And essentially, if you look at everything, they're trying to maintain our body's homeostasis and maintain a healthy body. So there's a lot of studies in the literature about stem cells, exosomes. But what about to GYN? And that got cut off, but it says GYN. Because this is why we're here, right? We're OBGYN for the most part. And how does this affect us? And so there are studies that talks about specific diseases that pertain to us. So for example, human umbilical cord MSCs mitigates interstitial cystitis. There's MSCs and exosomes role in interstitial cystitis and bladder pain syndrome. Studies on stress urinary incontinence. And specifically, this one's very interesting, exosomes that are secreted by urine-derived stem cells improve your stress urinary incontinence by promoting the repair of pubococcygeus muscle injury in rats. They actually have to injure these rats, cause an injury, which if you read the studies, it's very quite interesting. And the intraurethral injection of adipose-derived stem cells in rats also have shown to improve urethral connective tissue. And the bone marrow-derived MSCs have been shown to treat vaginal atrophy in rat models. This study shows an human-induced pluripotent MSC exosome. So what does that mean? It means, what's an induced pluripotent stem cell? It just means that you're taking a specialized cell, you induce it back to its pluripotent state, and that stem cells released exosome in the study, they put it into rat models to show that this is a piece of, or this is an area of a cutout in a rat skin. And when you put in exosomes on day 14, you can see that the wound healing is much different. And this slide shows that the same thing, what they did is they were looking at human dermal fibroblasts and endothelial cells, and they show that control versus exosome at this concentration right there, actually, where my face is actually a higher concentration, and it shows that the human dermal fibroblast and endothelial cells is stimulated in terms of its proliferation and its migration. And the scratch test is where they scratch the center of a plastic plate and how fast the cells migrate to the center. And so they have shown that this happens in a dose-dependent manner, and it increases your types 1 and 3 collagen as well as your elastin, promoting wound healing. And why is this important? Because we deal with wound all the time as obstetrician, as gynecologists, as cosmetic gynecologists, we're dealing with wound. So then you may ask, why not just give the stem cells? Why the exosomes? Well, it's really the question, the soldier versus the general. So if the therapeutic effects of the MSCs are carried out through exosomes, why not just focus on the exosomes? The exosomes are cell-free. Their cell-free therapy may have more clinical applications and advantages because they're more stable, they're more storable, there's no risk of aneuploidy, there's a lower immunogenic concern, so for example, graft versus host disease or host versus graft. And there's also no risk of ectopic differentiation compared to your MSCs. So in this table, it nicely summarizes the differences, but essentially in your MSC-derived exosome compared to your stem cell, you are essentially non-immunogenic. And stem cells are cells, so they also age. So exosomes, they don't have concern for senescence, and they're easier to generate in a large-scale model, so you can use it in clinical application. But the content of the exosome is the key. It's what's in the content, and it really reflects the origin. So the source is extremely important. The type of exosome you're getting is not all the same. So the potency of the stem cell, whether or not you're dealing with unipotent, pluri, or multipotent, are all very different. And like I said, stem cells undergo senescence, and so through different passages, they're going to age. So how you get your exosome, you really need to be asking that. And the environment in which the exosomes are produced can really alter these messages. So the exosomes from cancer cells can influence tumor progression. And studies have shown that exosomes from human umbilical cord MSCs possess tumoricidal properties. So really the conclusion is that the soldier and the general are both very important. So why does it, how do we apply this to us? Well, as an OB, as a GYN, as an aesthetic practitioner, as a cosmetic gynecologist, I deal with all these issues, and I'm sure many of us in this room have issues that we see related to these. And these are the common things that we see or are asked to fix. I'm sure you guys have patients that trust you, and once you fix their one issue, they're going to ask you to fix everything else. And so your urinary incontinence, your overactive bladder, pain in the episiotomy site or laceration repair site, decreased vaginal sensitivity, dryness, laxity, pelvic organ prolapse. I have patients that start to ask me if I can fix their stretch marks, their thinning hair, their melasma, their skin issues, and so on and so forth. So why did I introduce exosomes into my practice? Because I can't solve everything. And I have almost 6,000 square footage practice, and we have a lot of machines and toys and everything, and we're still looking. This is why we're here, right? We're always looking for something that works even better. And so the problems are still there. And I use PRP all the time. I love it, but they have variable results, and it's because the source is variable. The science really makes sense. Stem cells make sense. And the ease of use and cell-free option of exosome is quite appealing. So my experience in our practice, just a little humble clinic, is that we use it everywhere. Hair, scalp, face, stretch marks, C-section scars, overactive bladders. And now we've been incorporating this for all our post-op healing, for labiaplasty, perineoplasty, majoroplasty. We're putting them on topical exosomes to see whether or not they can heal faster. So I want to show you, this is just, everyone knows microneedling, but this is just one of my my nurse doing exosomes for stretch marks. And I'm sure you guys all do this, but you always test what you give to your patient, and I do the same. I love doing things on my face, myself, my staff. So this is my microneedling with PRP, and if you can just remember this picture. So post-treatment day 3, I'm still scabbing and scaling, and this is with exosomes. On day 3, I'm pretty much healed. Day 1, I'm a little red. Day 4, I'm out and about. And when you treat yourself, you got to treat your husband. So that's my husband. So I do his hair because he needs it, and I complain about it. And so microneedling with exosomes, you can do this really everywhere. And so if you have someone who doesn't have much hair, then numbing cream is messy. So what I like to do is nerve blocks, because injectable numbing is quite painful, and that's what I like to block. But I actually did not expect that much results. I'm always skeptical. I always question, and that's him. And so that's before and after, and it's actually only amazing once you start to compare. But if you're afraid of pain, and I don't know if you can recognize this lovely, handsome guy on the right, but he didn't want any needles in his scalp. So we started to use pain-free hair treatment with Exosome using predictive permeation. And using this collagenizer device, using the concept of dermal electroporation, we open up transiently the water channel and push in whatever we want to push in. And right here is exosomes. And I misted the exosome using an atomizer to help spray on the exosome. So future conditions we want to treat, lichen sclerosis. We had a great topic, a great lecture yesterday by Dr. Rennell about lichen sclerosis using lasers and exosomes. And so we really want to incorporate that. Genital urinary syndrome and menopause, pelvic floor disorder, just like the rat. If we can help improve the pelvic floor, why not? Stress urinary incontinence, episiotomy wound. And of course, combinations are always powerful. The big question is is exosome FDA approved? No, it's not. And so we got to know that. And you don't want to start saying things left and right because it's not approved. And topically is considered cosmetic. So microneedling, topically, it is not under the purview specifically of the FDA. But you got to remember, it's really your relationship with your patient. It's your honesty, it's your information, and it's your desire to learn and give your patient the best. That's what the patient trusts in you. And so when you are giving things that are not FDA approved or off-label use, you have to have the good intention be the core, because that will give you good result, and that builds the foundation to a good patient-doctor relationship. So in conclusion, stem cells-derived exosomes may be very beneficial for our patient. And exosomes may have the therapeutic benefits of stem cells while avoiding the risks and the issues associated with cell therapy. And the human body is so complex. We only are at the tip of the iceberg, if not even there. So we have to really think about that. I heard this doctor give a speech, and he said that we as doctors are not masters of medicine, we're practicing medicine. So you have to be open-minded, and that's why we're here. We're not at ACOG, we're not at our traditional OBGYN conferences. We're here because everyone here is thinking very forwardly. And so you have to be open-minded, but you have to stay skeptical, because we have to make our own decision. I'd like to thank Dr. Pelosi for your lovely invitation. It's my honor. And we have so much fun in the operating room with Dr. Alensod. Thank you so much.